All right. Hi, everyone. My name's Kate, and I'm joined by my lovely colleague, Melanie. And the two of us work at Ripple Wellness. I realize a lot of you know us, but I think some of you don't. And so it would be good, of course, to do a little introduction. So I'm going to start by introducing Ripple, and then I'll turn it over to Melanie and she can introduce herself, and then I'll follow by introducing myself, and then we'll get on with the fun part. All of it is fun, but the more fun part. Ripple Wellness is in Washougal, downtown Washougal, just down the street from Camas Public Library. Been in business for several years, and we're an interdisciplinary clinic, and we have a number of modalities, including naturopathic medicine, acupuncture, massage therapy, yoga therapy, and breathwork therapy, nutrition therapy, and mental health counseling. And we take a variety of different insurances, and all of our providers really work closely together. So there's a lot of our patients who end up seeing multiple providers, and we talk closely about those cases and kind of come up with sort of the best interventions for our patients. And so, yeah, that's Ripple. And again, just right down the street in Washougal on E Street. And I'm going to turn it over to Melanie and let her just introduce herself.
Hi, everybody. I'm Melanie. I have been with Ripple for just over a year now, and I joined Kate in providing acupuncture there at Ripple. I'm new-ish to Washougal, but I'm really loving being here and having the Ripple Wellness community be kind of my first community here on the southwest side of Washington. And yes, some of you are familiar to me, but it's great to see new faces. Thanks for coming. I hope you enjoy it. And if there's any aspect of this that you guys want a little bit more information about that we may not cover, Kate and I are both offering this in our treatments. So it might be a nice reason to come in and see us if you haven't, or if you already see us, we can work a little bit more with the Gua Sha during your treatment. So I'll pass it back to Kate.
Thank you. And I am Kate. I'm an acupuncturist at Ripple, and I've been there for 2.5 years. And yeah, this topic is something that is really interesting to me for a variety of reasons. Mel and I both really like to do Gua Sha on patients, and Gua Sha has made kind of a big splash in the social media world more recently for especially aesthetic medicine. And so that's something that I kind of get excited about, but more excited too about pain that somebody might have, like in the neck up. And I think a lot of us do, a lot of tension in those places. So if you've seen either one of us, you know that we both kind of work whole body. And so some of the things that we'll talk about today will apply to the whole body, and a lot of it will apply just the face and neck. So my big things that I really like to see at Ripple are fertility patients, both or all genders, lots of pain, and really digestion and sleep and mood disorders. So those are some of my things that get me really excited, besides aesthetic medicine. So yeah, I think we'll go ahead and then get started with talking about Gua Sha. So I'm going to, if you give me a sec, I'm just going to share. This is the first time I've ever shared a screen on Zoom. So let's see how I do. One moment. That might not be coming up. That's all right. I am going to maybe just start speaking, and I'll see if I can't get it as we go along here. I apologize. Okay. So the first thing I wanted to do is just kind of mention, like, what is gua sha? And a lot of you may know this or have been treated with gua sha, but the name gua sha comes from this Chinese word for scraping. But it's also sometimes called just skin scraping. Sometimes it can be called spooning or coining. And the reason that we might call it spooning or coining is because maybe you've seen these little spoons in your treatment room or being used on someone, but sometimes we'll use spoons, this is a ceramic ramen spoon. And then more historically, or even more in ancient Chinese tradition, they would use a coin. Of course, they would clean the coin, but coins have like kind of a perfectly rounded edge. And so they're really nice tools to use. So anything can be used for gua sha, but these are some of the tools and that we use to scrape. So gua sha is the practice of basically using one of these tools, as mentioned, to apply a pressure and scrape the skin. And in doing so, relieving some pain and tension. As you can imagine, though, depending on the pressure that someone is using, whether it be you to yourself or the practitioner, sometimes some bruises can appear, and that's completely normal, and it's actually desired because we're hoping to relieve some tension at the site that we're doing the work. And so sometimes the bruises that will pop up will be red or purple, and that is what we call the sha. So gua sha. So gua is the scraping, and the sha in Chinese kind of roughly translates to sand. So it's kind of like got a granular look to it, those bruises sometimes. So you might hear somebody call it like a fancy word for the type of bruise that it is. It's called petechiae. So these little sandy type bruises. So gua sha is most often used in our practices to relieve muscle pain and tension. In fact, it feels, if you haven't had it, it feels really good to do kind of on the neck and the shoulders. I use it on calves, legs, low back, mid back, just all over the body. I've used it on the bottoms of the feet for plantar fasciitis. It's really universal. You can use it kind of all over the body. But the intent of it, just like cupping, if you've had that before, is to address energy or blood or lymph or substance of the body that gets stuck and is stagnant. And sometimes when we're stuck and stagnant or tight in a certain place, that can cause like some localized inflammation. And that's what sometimes develops into pain for people. And so this rubbing of the skin surface helps to break up the stagnant stuff that's under there. And this is where I like to kind of go into some more information about what that stuff could be, because it really kind of helps us understand when Mel gets started with the demonstration part, like what we're actually doing. And so what we're doing is trying to move what is stuck. And the first thing might be blood or lymph. Blood, of course, is a fluid. And in blood, what is carried around are red blood cells and white blood cells and platelets and different proteins. So those are the different aspects of blood. And when we get blood circulating really well, as a side effect, you might see some kind of redness under the skin. So that could be sort of a side effect, and a good side effect, especially on the face when we're thinking about aesthetic medicine and getting that healthy, youthful glow. If we've got blood flowing really well to an area, the tissues get the nutrients that they need as well, because that's what the blood carries around, is that sweet, sweet oxygen that we need. And so red blood cells are bringing in that oxygen, cells get it, and then they start to respond. That also helps the cells build collagen, which is a protein in the body that we all love because it helps our skin look plump and youthful. So that's what we're doing when we're bringing more blood to the area. You also probably hear people talk about clearing out the lymphatics, and lymph is a whole nother ball of wax. It definitely has its own little circulatory system, just like blood, but it doesn't move as quickly as blood because there's not a lot of pressure in those lymphatic vessels that are under the skin. So it's really helpful to do some of these manual things to help get some of the lymph out of those areas. And what is lymph? Lymph is water. Lymph is metabolic waste, kind of just junk that your body doesn't need anymore, that kind of collects in between the cells. So our goal is to get that lymph circulated back to where it can be kind of disposed of. So I just like to call it trash and waste and fluid that the body needs to move out of those spaces. And then there's qi, which we talk a lot about in Chinese medicine. And qi is all of those things. It's blood, it's lymph, but it's also the thing that animates the musculature, the thing that animates the blood movement. So it's not just the physical substance, but also sort of the immaterial sort of spirit that animates these blood and bones. So the spirit is kind of another way to sort of look at qi. So qi encompasses all those things. So if you hear us say qi, we mean the physical part of it, but we also mean sort of qi as a spiritual animating force as well. So now I went down that rabbit hole, but I just thought it might be useful for you to understand when we clear these things out, we're bringing oxygen in, but we're also clearing out metabolic waste. And that's why we get sort of a lifted, sort of contoured, more brightness in the face, and kind of over time, sort of an enhanced look if we're going for that aesthetically. If we're using gua sha in another area, we might not be as concerned with the aesthetic look. All right. So some of the tools that we use. So a lot of people might have questions about, well, what tools do I use or what's best? And, you know, it really does depend on the person. And you can use all kinds of tools. Like today, I think Mel and I will be kind of demonstrating with tools like these that have like some different divots and contours. And I do tend to think that tools in general, it's best to have tools that have like lots of different surfaces. You'll see ones with like little combs in them, but it just gives you more options because nobody's anatomy is the same. We all have really, really different anatomy. And so, you know, what fits really well on my chin may not fit well on Mel's chin or over my cheek or over my eyelid, those kinds of things. So I tend to think that if you've got like a lot of different surfaces on a tool, the more options you have for facial gua sha. I do find too that the bigger the tool and the more weighty, the more desirable it is for me because I can kind of adjust my pressure a little bit more easily. It fits in my hand a little bit better. But you will see things like, you can see mine is sort of a jade knockoff, if you will. If you're aware of like different stones, they'll have like jade. I've seen rose quartz, I've seen amethyst. I'm seeing some people who have maybe some different things on the Zoom. But the reason why we might use like something like a stone like a jade or an amethyst is because or quartz, some kind of quartz, is because they're just generally cooling to the skin. And the cooling part really helps to move blood and lymph, especially when we're doing something that is inherently kind of warming to the area. So it kind of has a balancing effect if we're trying to to sort of to radiate some heat out of the skin, or to loosen up some areas that are tight and promote more blood flow. Like that's going to have a heating effect, or even just the fact of like kind of pushing on the skin will cause some friction that causes some heat. And so these stones are kind of meant for cooling or balancing out what we're doing with the heat. Again, like I said, you might on different body parts see us use the spoon. This is almost what I entirely use on the rest of the body. If I'm working on the neck or the back, I know Mel does too. We really like the spoon. This is the Gua Sha tool of choice at Ripple Wellness, unless you are working on the face. But like in my picture that I had for you, like I've shown like the top cap of like a water bottle, something that has a really good edge. And two, like if you don't have a tool today or even at home, like in future, you can always use your hands. Like you can definitely, you don't have to have a specific tool. It doesn't have to be expensive, but they can get really expensive too. So when we work with a tool, what is recommended is, especially on the face, is to not go very deep. The lymphatics, in fact, do well with really light pressure. And in fact, I kind of start with like the pressure of like, or the, like what would be like the mass of a nickel, like really light to start with, to kind of get yourself used to sort of the contours of your face and where you might be tight. So you're going to use really smooth but firm kind of strokes. And we typically just pick one direction and stick with it. So you're not going to go back and forth necessarily. You kind of pick one direction and go in that direction and pick up and come back, pick up and come back. So it's usually one direction. And we'll kind of detail to you why certain directions are more beneficial than others in just a little bit, but those are just some of the basics. All right. So some of the benefits just physically, I think I touched on a few of these, but it's nice to just kind of go over and remind. So really we're thinking about with making blood flow better, making lymph flow better. We're thinking about a brightening of the skin, sort of a sculpting of some of the facial muscles. And then sort of because we're sculpting and sort of bringing more blood flow, we're also in effect kind of softening some of the lines that some of us might acquire during aging, whether that be smile lines or crow's feet, or some of the lines that you might get kind of in the middle of your forehead. But some of the things I really like to use Gua Sha on the face for aren't just aesthetic. A lot of people come in with TMJ, so just really painful jaw work or jaw pain. And so we do some work to like around the joint, the jaw joint itself, but also in the muscles of chewing, which are kind of in this area. So a lot of people will get some pain at the angle of the jaw. There's lots of folks who have also some anterior neck pain. So it's great to work on that. Gua Sha can be really great for headaches as well. And, you know, people will have headaches in a variety of areas of the top of the head, the sides of the head, and so the back of the head. And so it can be really relieving for headaches. The thing I like it for maybe the most is sinus pressure, especially along sort of the nasal passages here. These are the underneath the skin here. We find these really large hollow places that are maxillary sinuses, but we also have some frontal sinuses up here, and you can kind of get in with the edge of the tool and sort of rub in these places to relieve sinus pressure. So those are some of the pain things that we typically see with or we use Gua Sha for. I think a lot of people also really like the idea of kind of eliminating some puffiness under the eyes, and we can have that for a variety of reasons. Certain disease processes can cause that. Having a lot of salt, if you're really sensitive to that and oversalted, crying a lot, many things could cause some facial puffiness. And so we're really getting into some of that lymphatic drainage there. Emotionally, I also find that performing gua sha can just be like a really nice ritual to get into before you go to bed or when you wake up, just whenever you decide to do it, but just kind of making the decision like, hey, I'm going to spend 5 minutes every night, like just caring for my face or my neck or a point on my arm, you know, just anywhere that you feel like you want to commit some time to. So those are some of the benefits. Some things to avoid. I always like to talk about contraindications to using some of these tools, especially tonight, if you plan to kind of follow along with Mel. It's good to know that it's not really recommended to use gua sha over like an active rash. So if you had like a breakout because of an allergic reaction or a sunburn, we definitely don't want to do over that. Cystic acne or just an active acne breakout, because sometimes you can break, like if it's a whitehead, say, you can break, I know this could be kind of gross, but you could break a pustule and kind of spread. And so you don't want to necessarily do that. The other thing would be like, if you had like a blood clot disorder, a blood clotting disorder, and you bruised really easily, or you were on a blood thinner and you know you bruise easily, that might not be something that you might not want to do gua sha on the face, because you could get some bruising. Some other things to know is that if you decide to do gua sha or receive gua sha, you may look a little pink or red in the face for a few moments after the treatment. And depending on the pressure that you use, you might actually show like a little bit more color for longer. So just be aware, if you bruise easily, I would tend on or caution you like on your pressure and just go really, really light with your pressure tonight. The other thing I want to mention, because so many people are doing it now, any sort of Botox or like facial injectables, you really want to wait about 4 weeks before you do any regular gua sha routine, just in order for the Botox or the injectable to do sort of the work that you're hoping for it to do. Just a note on that, or a side note, because I think it's important to say that Botox comes from the botulinum toxin, which causes tetanus. And that is something that is meant to freeze a muscle in place. So the hope is that you kind of don't move qi and blood as easily. And this is sort of the opposite mechanism. We're actually hoping to encourage blood flow, lymphatic flow. So it's to remove stagnation. So just kind of keep that in mind. And if you do have a provider that's providing your Botox, whether it be like a neurologist for migraines or it's an aesthetic medicine person, I might check in with them too before you decide, oh, I'm going to have Botox, and then a month later I'm going to try to do some facial gua sha. It might kind of go against what you're hoping to achieve. So those are some of those things. So I wanted to just say, like, as we start to get into the demonstration part of tonight, just some like basic steps for doing a little gua sha ritual. So do people have like a gua sha stone? Just hold it up if you do in front of you so I can kind of see. So most people do at home. Yeah, and no problem. Thank you, Mel. No problem if you don't, because you can use your hand as well. But the first really important step is to, of course, clean your stone. So if you are using it regularly, I'd say cleanse. And depending on the material, like the manufacturer may have some recommendations. I just like to kind of clean mine off with some soap and water, really. And then the next thing would be to cleanse your face. So doing some cleansing and then maybe some toner just to astringe like anything off the face, and then applying oil afterwards. So any kind of oil that plays nice with your skin is okay. Sometimes if you've had a treatment from Mel or I, oh yeah, jojoba, that's a great one. Love that one. I really like argan oil too. Olive oil, coconut oil. So anything you can kind of ingest that you're not allergic to is okay. Right now I have like a French lavender jojoba oil that I'm going to use tonight. So yeah, anything that works really well. And you'll find even that there are companies that make blends that are specific for gua sha. So yes, whatever works with your skin, feel free to use. And I would suggest maybe not putting on a ton, but just kind of patting lightly over the area. We don't want slippery. We just want something that will help the tool glide a little bit more easily. And you might have to play with that a little bit, like each time you do it, and you'll kind of find what your skin likes. Some of us have more dry skin. Some of us have more hydrated skin. And so your skin might soak up what you put on. So yeah, we apply some oil and then we do our little gua sha workout on our face. So Mel, do you have any oil on? Have you already applied?
Nope.
What are you using?
A vitamin E oil.
Oh, that's perfect. Lovely. Nice. Okay. So we're going to, for those of you, Mel's gonna kind of start getting into place and things. So she's gonna apply her oil. So if you all want to do that for yourselves, just over the forehead, over the eyes, over the cheeks, and some on the front of the neck. You can do on the back of the neck. We're going to be ending on the back of the neck so that, you know, if some of you have longer hair, it might be good to get it out of the way. So you can do that. So one thing before we get started is something I want to say about the lymphatics is that the face, what we often do on the face is that we start from the center of the face when we get up to it, and we pull out to the sides and then down the sides of the neck. And the reason that we go down the neck, down, is because the lymph, where lymph drains into in the body is over our major vasculature over the heart. So it dumps into these ducts that eventually go into cardiac or blood vessel circulation. So we're trying to encourage the lymph down so that the face has a place to kind of dump all that metabolic trash into. So we're going to start with the neck and we'll end with the neck so that we make a clear path for some of that metabolic waste to go. So that's kind of the outline of it. So Mel is going to begin, and she and I will both kind of talk over what we're hoping to show here. But again, she's starting with at the base of the neck, kind of right underneath the collarbone. She's going to start with some light circles right underneath the collarbone. And you can see here, what she's using is, if you have a tool like this, yeah, she's using kind of this more jettied out end. And she's starting kind of more towards the midline and making circles and headed out towards the shoulder. And Mel and I recommend doing this like 3 to 5 times, depending, like 3 to 5 passes, depending on how much time you have. Like some days you might not have as much time and some days you might have more. So kind of starting that way. Then she's switching to, as we can see, she's using kind of more the flat bit, the flat edge. And she's just going in that same motion under the collarbone, out towards the shoulder. And again, opening up sort of those receiving vessels for the lymphatics. So there's that. Then she's going to take kind of this teeth, this little indentation here, and she's going to take the top part over the top of the collarbone, or the more jutted out part over the top of the collarbone, and the smaller bit will go on the bottom, and she'll just track 3 times or 5 times like that. Okay. So now she's going to go take that same kind of long edge, and she's starting kind of at the front of the neck, right over the top of the collarbone, and then going to the back of the neck. And you can see, if you get kind of close, you can kind of see she's already starting to get red in all of these places. And that's what we're wanting. We're wanting sort of that increased circulation there. So 3 times that way up the side of the neck. That feels really good. Sometimes I like to linger on this one because my neck tends to get pretty tight. And of course, feel free, like some of these you might want to take out of context and just use in a pinch if you've got a tight neck or a tight jaw. So now she's doing, again, that tooth and coming down the side of the neck along a muscle that gets pretty tight. If you turn your head, rotate to the left or right, you can bunch up that muscle. And that kind of comes from behind the ear, and then it goes all the way down to the collarbone. And so she's just using that toothed edge to sort of come down the side of the neck along that muscle belly. Okay. Now she's going underneath the chin. So she's using sort of the longer piece again to go underneath the chin. Or are you doing,
I'm getting under the chin.
Under.
Really using that bigger bulge to get the pressure under that chin bone. So we'll trace the mandible next, but I'm really focusing on this bigger bulge, bringing it under that bone there and really encouraging up into back behind the ear where the lymph is going to drain nicely. So I'm and a lot of people will have a lot of congestion there. So it might be extra tender in here. Some people kind of just carry some chronic congestion there. So kind of tread lightly in that space there, because it can commonly be tender.
Also, sometimes underneath, like the angle of the jaw, some people will get really tender there too. You might, if you're a grinder, a nighttime grinder or a daytime grinder.
And now I'm using kind of equal pressure along the edge of the jaw. So both of those are really working. And this bigger bulge is going to end nicely here, kind of right in front of that ear there. Really I like to end my strokes with a little bit of like wiggle there. So I'm kind of making sure that I'm following through all the way to that anatomical place that I'm focusing on getting to. And with these longer strokes too, it can be nice to kind of give a little bit of resistance there where you're starting the stroke, so that the tissue has a really good chance of not necessarily like pulling with the stone. And this is also a place where our TMJ people are going to find they get, you have the masseter muscle here that's involved in that clenching of the jaw, and you're going to pass over it with this motion here. And that can be a place where it feels really good to work into there. Okay. Let's see. And then the next move we like to do is just a little bit of a smile. So I'm just kind of lifting the edges there. We want to create this lifting motion, right? So really kind of pulling up in that region. And then we're looking at the cheekbone here. Oh wait, let's actually kind of smooth out the jowls next. So I'm using this longer edge and just working through. This one feels really nice to get that whole area that you've kind of warmed up there and ending right there in front of the ear. And again, you're kind of thinking about lifting. So really focusing on that upward motion. And then we're kind of carving out the cheekbone there. So I'm using this edge here. I'm just focusing on kind of opening up that cheekbone. And then sometimes we get these little like smile lines here in the nasolabial groove. And this one is a really good move for people who get allergies or nasal congestion, kind of opening up that area there with just a nice circular motion. And it'll help with anyone who's kind of getting those lines in there. So we carved out the cheekbone there. We opened up that nasolabial groove. And now we're just going to follow the cheekbone with this angle here. So, and I like to make sure when I get up into the hairline, I like to make sure I'm following through all the way into there because the musculature of the face doesn't stop at the hairline. So we want to make sure we're kind of following through. And sometimes this one's nice to give it that opposite pressure again. Like that.
That feels really good in the hairline.
Mm-hmm. And again, this is a good TMJ spot because this musculature up here in the temporalis will get tight too. And you'll find that when you're following the jawline or the cheekbone there, this top portion can really kind of really open that up there and massage that. Then once we've hit the cheekbone, we want to kind of look at the under the eyes here. So I like to just use this nice spot here, and it's a really flat, like you're kind of flattening the stone to your face, and that's really going to help kind of depuff and smooth out the under the eyes there. You want to be gentle in this area. Our skin is a little bit more, soft and thin right under the eyes. Just be gentle with the orbit of the eye there. But again, you're kind of ending in that temporalis muscle and into the hairline, which feels really good for anyone who holds tension there with TMJ or headaches that present in that region. And then we move out. We're going to hit that a little bit more when we're kind of thinking about crow's feet. So those little lines that we get kind of on the edge of the eye there. And this is another circular motion I like to do, just kind of warming that area up. And then we're just smoothing out lines. So if we're getting those kind of crow's feet there, you're working your way out, smoothing those out. It feels really good in the temporalis. See the difference? My color. Okay. And then once we're kind of hitting that spot, we want to move into the brow. So there's a couple different techniques in the brow that are nice. You can kind of work again like those little circles And this one, you're really thinking about lifting, right? We want those like big, bright, wide open eyes there. No like drooping with the brows. So I'm using kind of an upward pressure there. So you can do the little circles like that. I like to do kind of this flat edge and like really lift like this. That feels good for me, but feel it out because you might find you prefer the little circles. And then you can follow that with this little edge here and kind of, let's do it this way, open up the brow. This one's a gentle movement too. You don't want to use too much pressure in here, but this one can really work the brow line. And some people just hold so much tension in their brows. A lot of people get headaches that manifest right in here. There's a couple foramen here. So foramens are these little holes in the skull where nerve and blood supply can enter and exit. So the brow holds a lot of power, and really kind of working that vasculature can feel really relieving. And then let's see, the 11 lines. So people get those kind of frowny 11 lines. That one is another circular motion. So kind of starting in, getting in the inner brow there and really just kind of focusing on opening that up. Like Kate was saying too, there's some good sinuses up in here. So if you're feeling congested at all, that's a good place to start. And then after the circles, I like to smooth that out. So I use this bigger rounded portion and smooth it out. And then you can kind of look at the forehead and we get, you know, the lines across. So we want to kind of counteract that with this long edge here. And just bring it up. And working our way all the way around. And then this one feels really good to just go across as well. So starting in the center there, kind of smoothing out like that. Okay, look at the difference. Nice and red and lackluster and lacking that circulation on this side. So it's nice to see those quick results. You can also just see that I do look a little bit more lifted here.
Mm-hmm.
So, and then, you know, I do one side, then the next. Some people like to work where they're doing, you know, the chin and then the chin, you know, kind of matching it on each side. I'm a one side and then the next. But feel that out for you. Anything to add there, Kate?
I think the only thing I really like to do once I've finished, and I'm the same as you, like I like to do one side then the other, but at the very end, I want to finish by bringing it all back down to the neck again. And I think a lot of us can identify with having a tight neck. So I do like to use this toothed edge on the back of my neck and go kind of either straight down the spine, or I do like to bring it back down again to the collarbone. So you can do kind of both. I'm not wearing the right shirt, but you get the idea. So yeah, I think that all of, like, I know that we presented quite a few moves, but I think that you can kind of, you know, pick and choose. But I would say the biggest thing would be to take home is always start with the neck and end with the neck. And that helps kind of again, clear out those channels so that any of the lymphatics that need to be kind of circulated better can do so because you've moved some of that congestion out of there. Yeah.
I think too, let's see, can you guys see me? Am I kind of highlighted for you?
Mm-hmm.
Okay. Yeah, I can't see me. So, oh, there I am. Okay. I think for a lot of people, like with tension that presents in the neck and back, like Kate was saying, it is really, so for me, the stone doesn't quite get into it the way I want to. But I have, like Kate was saying, the lid of things. So I have this like Badger Balm kind of sleepy blend. It has a really wide lid, and a lot of people might have like a loose leaf tea tin that has a similar lid. A lot of people have something of this sort lying around. I have also a thinner one, so it has a skinnier lid, but this lip is really powerful and can get into this tissue the way I want it to. So the thinner lip as opposed to the thicker stone, I think is really powerful. And I like to go from the occiput all the way down the trapezius. You can really reach around and get some good work in there. And a lot of people will find they have some crunchy spots. But for me, when I'm feeling extra tight, this is something thinner is a little bit more satisfying. And this is my go-to, this lid. But the soup spoon is also really easy to wrap around your backside because you're holding onto the handle there. And then you can, I didn't bring one in here, but, and then you can use that edge of the soup spoon to really get in behind your back. So that one is easy to kind of hold on to. And you know, not everybody has a soup spoon, but if you ever end up at an Asian market or grocery store, they're like $1.75 or something like that for a ceramic one. And you can almost always find one there. So if you ever happen on an Asian grocery, check out their soup spoons and add it to your little self-care toolkit. So
that's some good color there.
I know I'm so warm on my left side.
Yes.
I warmed myself up.
Is anybody else feeling warm? Okay. So we did have like this little thing that we wanted to show you with the muscles of the face, but promise me that when you get off of this talk tonight, that you just Google an image of the muscles of the face so you can kind of see what we were working on and through. There's all these little tiny muscles that you have no idea kind of move the mouth and like lift the cheeks and make the eyes big or small, just allow for us to scrunch and kind of express. They're just oriented in ways that muscles in the rest of the body don't seem to have the same sort of look. So it'll be good to see and also kind of highlight some of the things that Mel was talking about, some of the muscles like going into more of the scalp and on top of the head and why it's important to kind of really finish those long strokes and sort of jiggle in some places to release some tension. So
Kate, I might be able to, I'm going to try and share my screen just real quick.
Okay, great. Thank you. I'm a little technically challenged tonight.
Okay. Can everybody see the face?
Oh, there it is.
Okay.
Oh, yeah.
So can you see my scroller as well?
Yes.
Cool. Okay. So yeah, a lot of this. So yeah, let's start down at the chin. A lot of this musculature here, the masseter is a big one involved in TMJ, and you can see how it is really closely related to this temporalis muscle, which most people in their TMJ presentations will have some pretty tense musculature here as well as in the temporalis. So really kind of thinking about, we didn't follow the muscle fibers of the masseter in our explanation today, but if you experience with TMJ, that's something you can do, is follow these muscle fibers as opposed to just bringing across, right? And that can be really powerful. And then in the temporalis, this is a big one for headache presentations as well as TMJ. And this one feels really good. Similarly, you can follow these muscle fibers into the scalp here. See how the hairline kind of comes in a little bit anterior to the edge of this muscle belly. So really making sure to follow into the hairline is important to get all of that musculature. And then, you know, the smile ones we did is nice because you can really see how the zygomaticus, this one here, is what helps to lift. Well, also the buccinator, it's a little bit deep to it, but the buccinator and the zygomaticus are really helping to lift our smile. So we have those muscles to think about when we're doing that smile one. And then these muscles up here in the like frontal region of, you know, where the 11 lines, you can see why the 11 lines happen. Look at this musculature. So kind of working into that inner brow there and pulling, getting those circular motions in and then pulling up is really nice. And then following, as we did, following this frontalis muscle up into the hairline. What else? You know, it doesn't really show the neck very well in here, but following the neck musculature in here is really powerful because almost everybody has tight scalenes just due to the nature of being on our phones and kind of, you know, having that head protruding forward as well as looking down at our phones. Maybe some of us are sitting at a desk and, you know, bringing that chin back is a nice way to soften this musculature, but I don't see any patients who don't need a little bit of help in their scalenes there. So focusing the gua sha in there can be really powerful too.
Yeah.
Okay, I'm going to stop sharing. And I'm checking out the chat here, just making sure. Let's see. Okay. Oh, the inner lip.
The thinner lip of like the thinner. The thinner lip of like the lid that you were using.
Yeah, the thinner edges are going to give just that little more focal pressure as you're scraping along the tissue and will more easily bring on that sha, the petechia that Kate was talking about. Mm-hmm. And just in that muscle, the trapezius, and, you know, the levator scapula, all of those muscles back there that are commonly tight, those ones you can and likely want to give more pressure to than any of the musculature in the front of the neck or the face. So just naturally giving a little bit more pressure back there is another contributing factor to seeing some more of that color come up. Mm-hmm. Yeah. Does anybody else have any questions? Anybody have any spots that they struggle with pain or tension or anything like that that they're curious about?
I do.
Yeah. Okay.
Behind my ear, where I've been wearing a mask for 3 years, it's really, really super sore back there. Do you have any suggestions of what to do? Just on one side.
Just one side.
You mean like kind of right underneath the ear, or
no, on the side of the ear, right on the side. It's on my head, but on the side, yeah, on my head, but across from my ear on the side, yeah, where you're pointing, yeah,
back, kind of behind
right,
here.
yeah, back there, yes,
yeah. With this tool, I might use the kind of the long edge, so this edge here, and start kind of where you feel the bone sort of jutting out the most. Do you feel kind of the bone back there?
Yes, yes,
And I would just go kind of start there and use your other hand, of course, to hold your hair if you've got longer hair, but also kind of as a brace. And I might pull down the neck.
That's what I was doing when I was watching you with my soup. I have a soup spoon.
Do you?
And I've been doing that with it, and it seems like it's feeling better.
Oh, good.
Yeah.
Good. You can also, like Mel was doing, like with some of like the work on the eye. Sorry, my screen is so small, but kind of getting it in these pinpoint circles. So using this longer edge and get back there with that and find the spot that feels the most tender, and you can just kind of rub really lightly. I caution against, like pushing very hard, but definitely, you can get in there and like make some circles. And I would do that also down towards the neck.
Thank you.
Yeah. Mel, do you have anything to add to that maybe?
No, I like it. That's what I was going to say. I also just around the ear, we typically think about that as the gallbladder channel, which kind of wraps around the ear, from the occiput, it wraps around in this fashion. And so it can feel really good to work like in that motion. So it might be like small little kind of circles around in that pattern, because you can kind of think about following the gallbladder channel there that's lying there, just kind of opening it up from the front of the ear all the way around the arc there.
One last thing I really like to do is take my index finger and middle finger and put it one basically on one side of my ear and the other on the other side, and then just up and down like this. So just provide some friction, and that can help kind of drain the ear, but also reduce tension in the front and the back of the ear too. It sounds kind of funny too. I think we have one other question here.
Denise on the chat. She is so funny. In your opinions, could regular gentle application of this technique improve the depth of these creases or just prevent further deepening and facial sagging? Both. I think if you're consistent with it, it's going to help, like Kate was talking about, with the collagen production or the collagen in the blood. So like encouraging that collagen to plump up those deep creases, and then also further prevent deep facial sagging.
No sagging here. You all look beautiful.
Yeah. Denise, you are glowing. I don't know what you're talking about.
Any other thoughts or questions?
I think I just want to pop in and say, would you recommend these tools to be chilled before using? That can feel great. It really can.
Especially if you have a lot of sinus pressure. I do like to chill some of my tools. And we didn't talk about the rollers. Like some of you may have a roller. I've seen those rollers. Those can be nice kind of underneath the eyes, but I really prefer the rollers to be chilled, and I'll put on some of the oils that we were talking about. Like I'll spread it out with the roller, and then I'll use the tool, the Gua Sha tool, to scrape, but I like to chill my roller.
I also chill my roller, but not my other tools. It does feel really good with that chilled one. Yeah, I also have a fun tool like this.
Ooh.
And this shape can feel really, really good. You know, like Kate was saying, find the shape that you love. This one in particular, I just really like on like my eyes. So this one is one that I might chill as well because it feels really good here and under the eye. It's kind of that perfect, nice, gentle concave shape that feels really good in the orbit of the eye there. So there's so many tools out there.
Yeah. And of course, like if you buy a tool and you are curious about how to use it, come see us. We'll definitely show you.
One more, Denise. Dark circles under the eyes. Yes, definitely will help.
Yeah.
Mm-hmm.
Yeah, it's a lot about like moving, as we mentioned, like chi and blood and lymph. Yeah. And I find I actually was experimenting on this with on myself. Like I just was doing gua sha on one side of my face for like a week and not the other side. And I could definitely tell that dark circles that I get under my eyes was greatly diminished compared to the other side. So yes, absolutely.
Yeah. Great questions, guys. Well, thanks for coming.
Thank you, everybody.
Thank you so much for sharing with us, ladies. We greatly appreciate it. And I will be sending out the recording to everyone tomorrow, as well as any notes we have. So be on the lookout for that. And I hope you all have a wonderful evening. Good night.
Bye. Thanks.